Hi all, welcome back to my channel. I hope you guys are doing good. Today I am going to discuss about Glasgow Coma scale, which is a tool used to assess the neurological status of an individual. Let's move on to the topic. The Glasgow Coma scale is a tool used to assess the level of consciousness in an individual. The score will be given based upon the three responses. The first one is eye opening, second one is verbal response, and the third one is motor activity. Let's see how to give the score based upon the response of a patient. First one is eye opening. Here, the maximum score is 4 and the minimum score is 1. While assessing the patient is opening the eyes spontaneously, you can give a score of 4. If the patient is opening the eyes only to sound, you can give a score of 3. For instance, you are calling the patient by his or her name, then only patient is responding by opening their eyes, you can give a score of 3. If patient is opening the eyes only to painful stimuli, then you can give a score of 2. If patient is not at all opening the eyes, no response, then you can give a score of 1. The second one is verbal response. Here, the maximum score is 5 and the minimum score is 1. So, if the patient is oriented to person, place, and time, then you can give a score of 5. For instance, you are asking, where are you? And the patient is telling, I am in the hospital. You can give a score of 5. If the patient is confused, for instance, you are asking, where are you? Patient is telling, I am at home. Then you can give a score of 4. If patient is telling some incoherent words, then you can give a score of 3. For instance, to your question, where are you? Patient is responding, Christmas, my birthday, daughter. Then you can give a score of 3. If patient is making some incomprehensible sounds to your question, then you can give a score of 2. For instance, you are asking, where are you? Patient is responding, some sounds. Then you can give a score of 2. If patient is not at all responding, then you can give a score of 1. The third one is motor response. Here, the maximum score is 6 and the minimum score is 1. If patient is obeying your commands, for instance, you are telling the patient to raise his or her right hand and the patient is lifting, you can give a score of 6. If patient is localizing only the pain, not obeying the commands, you can give a score of 5. To a painful stimuli, if patient is showing some fluxion, you can give a score of 4. If patient is showing some abnormal fluxion, in other words, decorticate to a painful stimuli, you can give a score of 3. If patient is showing some abnormal extension, in other words, decerebrate to a painful stimuli, you can give a score of 2. There is no response, no movement, then you can give a score of 1. This picture will clearly tell you how to give the score based upon the motor response of a patient. As I said, the maximum score is 6 and the minimum score is 1. So if the patient is obeying to your commands, you can give a score of 6. And if the patient is localizing to pain, for instance, you are giving a trapezius pressure and the patient is trying to remove your hands, then you can give a score of 5. To a painful stimuli, if the patient is normally flexing his hand, but he may not able to remove your hands, then you can give a score of 4. Here, if the patient is showing some abnormal flexion towards a painful stimuli, you can give a score of 3. So here, abnormal flexion, you can see the fist turn inwards, and also the legs are rigid straight and the toes turn inwards. This posture is otherwise known as decorticate posture. Then you can give a score of 3. If the patient is showing some abnormal extension towards the painful stimuli, you can give a score of 2. So here you can see the fist turned abnormally outwards, extended outwards, and the toes facing downwards. The legs are rigid and straight. This posture is otherwise known as decerebrate posture. So you can give a score of 2. If patient is not at all responding, then you can give a score of 1. So if the patient is not responding normally, then we have to give a painful stimuli. Here we can see how to give a painful stimuli. We can give a painful stimuli by applying supraorbital pressure or trapezius squeeze, sternal rub, or nail bed pressure. In the following slides, you can see how to give that exactly. So in the first picture, you can see how to give a supraorbital pressure. So you have to apply a pressure in the supraorbital area. The second picture shows trapezius squeeze. Through this way also, you can give a painful stimuli. Next one is sternal rub. Here, by using the knuckles of your hand, you are rubbing against the sternum in order to give a painful stimuli. The last one is nail bed pressure. Here, by using the pen, you are applying some pressure against the nail bed. So now you got an idea how to assess and give the score according to the response of the patient. Let's see one scenario. Here, a patient got admitted with RTA, road traffic accident, and when you are assessing, the patient is opening the eyes only to painful stimuli and making some incomprehensible sounds, abnormally flexed his arms. So how much is the GCS? So here, as the patient is responding or opening the eyes only to the painful stimuli, you can give a score of 2. In the verbal response, patient is making some incomprehensible sounds, so you can give a score of 2. And in the motor response, patient is showing some abnormal flexion, so you can give a score of 3. So the GCS is E2, B2, M3, and the total score is 7. Here we can see what this score indicates. If the GCS score is 15, that is normal. If the score lies between 13 to 14, that indicates mild brain injury. If the score lies between 9 to 12, that indicates moderate brain injury. If the score is between 3 to 8, that indicates severe brain injury. So, in conclusion, 15 is the highest score and 3 is the lowest possible score. The score is 15, that means the person is normal. So the patient will open eyes spontaneously, well oriented and alert, and obeys commands. If the score is 8, you have to remember that is the point of intubation. So any patient with an GCS 8 or lower than that is strongly considered for intubation. If the score is 3, that is the lowest possible score, here the patient will be fully unresponsive. Thank you so much for watching this video. I hope this would be very helpful for you guys, not only theoretically but also practically. So if you feel the same, kindly like, share this to your friends and subscribe my channel. My channel name is Chebin Shine, and don't forget to press the bell icon button so that you will get the notifications whenever I am uploading new videos. Thank you all once again. See you all again with one more interesting topic. Until then, it's bye from Chibin. Bye bye. Take care.